And I'd like to ask a very special person who has made so much of this possible for us. It's been through her vision, her strategic thinking, and I have to also, her coaching that has made this possible for us to be here today. Dr. Patricia Pittman. Polly, please come up. Join me.
So most of all, I just wanted to say how exciting it is to be here today. This has been a long haul. I think we started on this process 3 or 4 years ago. 5? Ouch. And it's had several iterations. We were fortunate to have funding from the MacArthur Foundation to explore the possibility that we could create a code of conduct that was similar to the nurses, but obviously had its differences. I had the privilege of leading that project in its early years, and in a moment I'll introduce the new leader of the project. Frank has asked me just to say a few things about sort of lessons learned from the healthcare side and some of the similarities and differences with the education side. So, obviously there are a lot of similarities in terms of the kinds of problems that people were experiencing during the recruitment process. There were problems in terms of the lack of regulation and enforcement in the sending countries, and similarly in this destination country. There's also, I think, a recognition in both cases that a voluntary code of practice is simply one tool in the toolbox. It's not the magic bullet. It's not the only thing that people should be working for who care about these issues. And I think we were cognizant of that on the healthcare side as well as on the education side from the very beginning. To the extent that this gets the issues out there, it shows that it's possible to create consensus around standards. These kinds of codes can lead to other things. They can lead to international agreements. They can lead to state-based regulations. They're not, in and of themselves, the end-all. They do, however, represent an important step forward, we think. So in that sense, there were a lot of similarities. There are also important differences. So a huge difference, I think, from a strategic point of view, is that many of those who are employing staff in agencies that bring over the international teachers are public sector schools. In healthcare, it's entirely private. So the responsibilities of the public sector with regard to treating their employees in a fair way is obviously, I think, an issue that is somewhat more accessible than dealing with the fragmented and very chaotic healthcare system than we have in this country. So I think, to some extent, that has been an advantage. And I think the presence of Baltimore City Schools here today is a testament to the receptivity of the public sector to these issues and their intent to do better in the future. Obviously, the visas are different, and that creates a whole area of gaming of the process that is its own story. The other thing that was really different is the process of developing the standards, and in part it had to do with the two distinct groups of stakeholders that were involved at the very beginning. But I would say that it's fair to say on the healthcare side, there's always a trade-off between the level of standards and the number of stakeholders that you have that agree to those standards. And on the healthcare side, we made a huge effort to ensure that all of the stakeholders possible would stay at the table. And therefore, the standards are less rigorous than those that were achieved in the education side. I think there was a decision among the leadership not of me, but of the stakeholders, that they were willing to go forward with more rigorous standards than we were able to achieve on the healthcare side, but of course with a smaller group of leaders as a result. And I think there's kind of an interesting social experiment that's been set up here with the two codes, and there's mutual learning. I think on the healthcare side, there's a lot of interest in tightening up that code so that it is a stronger set of standards, and particularly in the area, for example, of fees and the issue of staffing agencies. These are issues that were left out of the healthcare side. So while the healthcare side started first, I think the education side is really taking the lead in many of these issues, and those of us who came from health policy are really interested to see how all of this plays out. I think there are important challenges here. This is not going to be easy road forward. This is just one milestone. Coming to the National Press Club and announcing consensus among a subset of the stakeholders around these standards is really exciting. But there's a long haul ahead. And obviously that has to do with dissemination of the code and uptake of the code. And I think that there are two parts of that. One is sort of the art of advocacy and diplomacy, which takes a lot of political acumen and a lot of energy, and we've got to really keep that up over many years, and we'll have to see how we do on that. We've got to keep focused. And the other, of course, is the financial sustainability, and that's where I think CGF&S can play an important role. Obviously, an initiative like this cannot be entirely fee-based, but nor can it be entirely dependent on the goodwill of foundations. We were fortunate to have the MacArthur Foundation early on. They've now changed their priorities. We need to think about other ways to sustain this work. And CGF&S has a series of services that they can provide to employers and to migrants that might be able to sort of identify the way forward in terms of how to sustain something like this. It's really important, I think, that although these two initiatives fall under the Alliance umbrella, and although we are thinking constantly about the similarities and the lessons learned, that they do remain distinct because the communities are distinct, and because the specificities of the process, to the degree that we lose sight of those specificities and we stay at the level of rhetoric, the instrument is really not very powerful. So we really do care about the details, the business models, and for that we need to continue to do research, we need to continue to study it because it changes. It's very dynamic, and so we need groups of people who are focused on specific industries. We also need those different industries to be talking to each other, and in that sense the Alliance appears to be sort of setting a culture of distinctness and yet sharing lessons learned that could be very exciting, I think, and possibly expand to other sectors as well, because we know, of course, that this issue of recruitment of workers to the United States is not just in the healthcare and the education sector.